Have you ever stopped to think about how Brazilian nuclear medicine connects with the rest of the world? International relations, partnerships, and negotiations for new technologies are fundamental for thousands of patients in our country. For today's episode, I have two very special guests who are specialists in the field and work at Medical. For that, I invite you to stay until the end of this episode and not miss any information. Tom, play the intro. Welcome to another Medical Isotalks, the first podcast dedicated to the behind the scenes of nuclear medicine. And for this special episode today, we welcome Dr. Heber Videira, who is the Director of Research, Innovation, and New Business at Medical, and Dr. Felipe Meneses, who is a pharmacist and also the Regulatory Director at Medical. Welcome. Thank you once again for participating in this episode. It's great to have you here. So today we're going to talk about these international relations that Dr. Heber always highlights when he participates in our episodes because they really are a pillar of nuclear medicine. We depend a lot on the foreign market. So Dr. Heber, I'd like you to talk a little about the importance of these relationships for the Brazilian nuclear medicine market.
Perfect, Mayara. Actually, for me, it's always a pleasure to be participating in our episodes here, and to bring up such a crucial topic as this one, which is precisely international relations, right? Because Brazilian nuclear medicine really depends, right? On the outside, we depend on the supplies, we depend, in fact, on the radioisotopes, we depend on the pharmaceuticals. So, having this partnership, having in fact the solid knowledge, to see our need here and seek partners abroad is of fundamental importance to guarantee, in fact, the sustainability of the chain, sustainability, and always remembering that our patient is the one who should benefit from these solutions.
Yes. And Felipe, how do you see these relationships interfering in our daily lives in clinics throughout Brazil?
Well, Doctor, first of all, it's a pleasure to be here again. And well, a good example to give is that recently we were able to bring in Radqual, for instance, with the introduction of some products, in Brazil. And having a source, that provides a correct reading on your dose calibrator will increase the efficiency, of the clinic. It will facilitate, the routine and perhaps even increase the number of patients depending on the way that this is done and organized within the clinic. So having a source, and our sources, they have a higher purity. So bringing in these international contacts that have quality products with an international reputation already into Brazil, it only helps, Brazilian nuclear medicine to grow as well.
Yes, just to recap a bit, Felipe, these sources, they calibrate the equipment so that they function correctly. Is that right?
Yes, yes. Both the equipment that the patients use for exams and also the dose calibrators that are there inside the radio pharmacy, which measure the dose that will be injected into the patient.
Yes, that's super important. If you measure an incorrect dose, it will directly interfere with the result of the.
Exactly. It also interferes with the nuclear physician's analysis because if it's for a PET scan, right, you'll need to know exactly how much was injected to be able to do all the calculations correctly, right? So,
Yes, wow, it's essential for a correct report.
exactly.
And Dr. Heber, how do these international partnerships benefit patients in Brazil?
Yes, actually, it's extremely important for us to bring up this topic, because it's in these partnerships that we're able to see what's out there, what radioisotopes are available, what supplies are available, so that we can perform the synthesis here, whether for the radiopharmaceuticals that will be produced via cyclotron or the radiopharmaceuticals that will be produced from isotopes in industrial radiopharmacies. So it's of fundamental importance because it will bring our patients the same quality, the same care that they have in first world country. So that's what I advocate for us, that international relations are for us to go abroad, to present a scenario, to present the, let's say, the potential of Brazilian nuclear medicine, to show the chain, the suppliers, that we have possibilities, and that we have all the knowledge and the necessary regulatory framework to bring in these radiopharmaceuticals with reliability, safety for use in Brazil. So the benefit for our patient is that it's not about us going, for example, to a congress, be it the European Congress, the American Congress, seeing there us talking about theranostics, which is the topic of the moment, seeing countless possibilities and saying, how does this get to Brazil? How do we bring this to Brazil? So that is the role of international relations, which will involve the Brazilian need, knowing what is cutting edge out there and how to bring the two together, how to bring it, how to see, to show our supplier abroad that the Brazilian market needs and has the potential to bring in this solution.
Perfect. And Dr. Felipe, could you give us an example of an international relationship that Medical has had with a company, for instance, Abacon?
Yes, we have, Abacon. Abacon is a supplier of medicines, radioisotopes as well. We they are we are in the process of registering, the generator and iodine capsules. So this relationship of assisting the manufacturer, in the quest to understand Brazilian legislation,
Which is complex.
and it's not just the health surveillance agency, but also the Federal Revenue Service. There are several bodies, and we provided all this help, to support the entry of these products into Brazil. So this is a successful partnership, that's worth mentioning, and that brings these benefits, brings these different things to Brazil. Today we sometimes have only one supplier, and so by bringing in others, the clinic can adjust, it can make a decision, it looks for what, who, and how it wants to do things. So all of this affects the day-to-day of nuclear medicine, your routine,
Yes. And Dr. Heber, in the WhatsApp groups, there's always, a widespread pessimism regarding nuclear medicine. And I'd like to know what your perspectives are on the future of medical's international relations with other countries.
That's a great point, isn't it? Yes, we see it too. Mayara, there's always that anxiety, that difficulty, that doubt, partly because of the moment, that nuclear medicine is going through, right? But we really see a promising future for nuclear medicine. It's a brilliant specialty, isn't it? So, as we've even discussed in other episodes with some doctors and with the participation of the doctors at the Brazilian Congress of Nuclear Medicine, where we discussed this. So, I see a very important future for nuclear medicine. This future, it is being paved, with initiatives like this one, as Felipe rightly said, because we can't just look to the future. So let's talk about theranostics, let's talk about actinium, let's talk about lead, you know, let's talk about the other isotopes, that we can bring mainly to form the theranostic pairs, and forget the difficulties that we're going to have literally in the day to day with a technetium generator, with an iodine capsule. So all of this has to be worked on together. And I see that medical today, it brings these relationships, these partnerships. We have traveled a lot, haven't we? So for those who want to follow along, you can even follow me on social media, on Instagram at Dr. Heber Videira.
Folks, he's very active, okay? If you want to stay updated on physics and nuclear medicine, follow Dr. Heber Videira.
So there we've been showing exactly the work we've been doing, right? Visiting suppliers, visiting congresses, understanding what's out there to bring the trends to nuclear medicine. And then it's about making it viable. So I think the word of the moment today for nuclear medicine is viability. We have to know the ropes, whether it's economic, regulatory, supplier related, or about internal needs. Whether it's bringing the radiopharmaceutical ready made or how to produce it in Brazil to bring that to our patient. So that's what we advocate for on our podcast, right? It's precisely our patient. They are the main beneficiary, they are the one in need, and we're here to make it viable for them. So, what I see for nuclear medicine in the future is this: it's about paving the way so we can literally get through this tough period with suppliers to have this sustainability, this economic viability. Then, yes, we'll get to the point of bringing the best the newest from abroad to our patient.
I share your enthusiasm. We see that nuclear medicine really progresses a lot by leaps and bounds every year, but even so, we have many challenges, right? Felipe, what are the main challenges you see that nuclear medicine will still face with these international relations?
Well, I think the most difficult things, for international partners is understanding what we go through here,
Our regulations, right?
all the current legislation, the classifications. So all of that is really very complicated, right? We recently went through a resolution where we had to reclassify the sources. So the sources were classified in one way, and we managed to change their classification to make it a better fit. But all of this requires an analysis, both from the internal team, here in Brazil, and from the factory, right? This assistance in sending documentation, in understanding the need for what we require, in subsidizing new tests. Because sometimes the Brazilian team at Anvisa, for example, requires a specific test that the factory sometimes doesn't do yet for whatever reason. So, for them to understand the need of the Brazilian legislation requiring this test. So, all of this is the biggest difficulty, right? Acting as the go between with another company. I think that's why medical still provides great support. Since we have the experience of bringing in other companies, we can provide this support so that the company abroad can also be at ease with what they're bringing because it's very complex, right? You look at Brazil from the outside and think, wow, what am I getting myself into? It's not that simple.
Yes. So, everyone, with this episode, you've understood how complex the Brazilian nuclear medicine market is, which unfortunately isn't self sufficient yet in supplying radioactive material. And medical is very active, fighting through the regulatory issues so that nuclear medicine can continue to grow. I hope you enjoyed this episode. If you have any suggestions or criticisms, please write them here in the comments. Don't forget to subscribe to the channel. It's very important for the algorithm to understand that Brazilian nuclear medicine is important and for this content to reach a larger audience. Also, don't forget to follow Medical on our social media, Instagram, and LinkedIn. Leave a like. We'll see you in the next episode.